name is Tom Weiser. I'm a general and trauma surgeon from Stanford University. I would like to tell you about a Lifebox program called Clean Cut, which is an infection prevention program. The aim of Clean Cut is to improve compliance with known standards of perioperative infection prevention. It's based on the WHO Surgical Safety Checklist, and it focuses on compliance with 6 standards of care, perioperative care: the appropriate preparation of skin, both surgeon's hands and the operative site; the appropriate selection and timing of antibiotic prophylaxis; the maintenance of the sterile field during surgery; the assurance of instrument sterility; the routine counting of gauze and sponges before and after surgery; and then the use of a surgical safety checklist to improve teamwork and communication. We've recently published the results of Clean Cut in the British Journal of Surgery. The most important results that I would like to discuss are threefold. The first is that after the implementation of our program, we were able to improve compliance with these 6 standards dramatically. So hospitals went from an average of just under 3 of those 6 standards to well over 4. So the idea is that many hospitals improve compliance with those best practices. And this is better seen on this graphic here, where perfect compliance is the outside of this spider plot. And what we see is at the beginning of the program, the hospitals were in blue, where they had very variable compliance with these basic standards. And after implementation of the program, we saw dramatic improvement, which is defined by that outer dotted red line. Most importantly, we noted that after implementation of the program, we also had dramatic and significant reductions in surgical infections. So after the implementation of Clean Cut, we noted that the relative risk of surgical infections reduced by 35%. Just as importantly, we also noted that when you compared patients with low compliance to these standards versus patients with high compliance to these standards, patients with high compliance to the standards had a much lower risk of infection, a nearly 50% reduction in the risk of infection with good compliance with standards.